Hello, welcome once again to Logistics Management System in the Health Sector. I am Dr. Henry Achsagbohi, and in this session, part 5, we are going to explore how to sustain health equipment and logistics operation through effective agreements and maintenance practices. As a reminder, we have it in series, and we concluded the part 4. And just as a recap to help you so that you can be able to fit into the part 5 and understand properly what we are discussing in case you have not watched the part 1, part 2, part 3, and part 4 so far. In the part 4, we talked about commodity security, how it ensures uninterrupted access through good forecasting, strong supply chains, proper storage, and compliance. We also looked at equipment management, how it involves proper procurement, storage, and regular maintenance to prevent breakdowns and waste. We also looked at legal oversight because it guarantees safety, accountability, and protection against equipment-related failures. And we looked at how logistics in public health, have so far fared. And so we advised that we should not just think of moving goods anytime we think of logistics in public health, but we should think of protecting systems, preserving lives, and ensuring accountability. So once again, if you have not watched that video, you can check on the YouTube page. You will see the part 1 to part 4. I welcome you again to the part 5. And today, on this part, we'll be focusing on 3 closely connected operational and administrative pillars that ensure sustainability, if I may put it that way, and accountability in the health logistics system. Number 1, we'll be looking at Memorandum of Understanding and the legal documentation. Number 2, we'll look at routine maintenance. And number 3, we'll look at planned preventive maintenance. You see, good procurement and storage mean little if there's no framework for accountability or sustainability, as it were. That's where Memorandum of Understanding, routine maintenance, and planned preventive maintenance come in. So let's begin with understanding what an MoU really means in the context of health logistics. So let's see Memorandum of Understanding and legal documentation. Then we'll look at the purpose. Then we'll look at the key components. And we'll look at some case study. So let's look at Memorandum of Understanding and legal documentation. A Memorandum of Understanding, or what you know as MoU, is a formal agreement between 2 or more parties that clearly spells out their roles, it clearly spells out their responsibilities, and what the expectations are. In the logistics context, it defines how government agencies, donors, suppliers, or maintenance contractors will collaborate to ensure a smooth service delivery. What are the purposes of an MoU? We'll look at 4. The purposes of an MoU. Number 1, it defines roles and responsibility. In other words, it clarifies who does what. For example, who supplies the commodities, who maintains the equipment, and who monitors the performance. Number 2, it sets deliverable and timelines. And so that way you provide a schedule for deliveries, maintenance cycles, or report submissions. And this ensures everyone is accountable, both to time and targets. Number 4, it provides legal assurance. Remember, we're looking at the purpose of an MoU. It provides legal assurance. Though not as binding as a contract, an MoU provides legal and ethical assurance to protect the interest of all parties involved. Every party involved will be protected because there is a binding contract now, so everybody will mind their business thoroughly, because not minding yours will infringe on the other and you can be sued. So you see, that legal documentation and ethical assurance will protect the interest of all parties involved. Number 4, facilitates coordination. One of the purposes of the MOU is to facilitate coordination. You know, when you have a large program that is involving multiple partners, coordination might be difficult. For example, like the Ministry of Health, NGOs, and private suppliers. You need the MOU because the MOU will promote synergy and will reduce conflict. It will be spelled out who does what and who is to handle whatever needs to be handled. It will clarify it. Everyone's scope will be seen, everyone's domain will be respected, and the outcome will be without conflict. Let's look at a simple case study here. A public hospital signed an MOU with an equipment vendor for timely maintenance of laboratory analyzers. As a result, downtime reduced significantly, service interruptions decreased, and diagnostic accuracy improved. That's the beauty of having an MOU. The engineer knows too well that he must be available at all times to ensure that the equipment is serviced because there's an agreement. A timely maintenance will be ensured. And so this happened for the laboratory analyzer. As a result, issue of downtime reduced significantly. Service interruption, so we are very sorry, our machine is down, give us some hours. The engineer is already working on it. That will reduce. In fact, it reduced significantly. And then diagnostic accuracy really improved. All thanks to the timely signed memorandum of agreement, understanding which was reached between the maintenance department and the laboratory. So that's a perfect example of how simple documentation can drive accountability and operational excellence. I like us to look at the importance of MOUs now. The importance of MOUs. We'll be seeing them in some simple lists. Number 1 importance of MOU is to ensure transparency. You know, transparency in partnership. Everybody becomes sincere because there's an MOU. So you do your part, I do my part, you don't infringe on the other's part. Number 2 is clarity. That is clarity of deliverables and timeliness. You know what to deliver. It is clearly written and the timeline is written. Number 3, legal protection. In case there is a dispute, we know who we can do a feedback analysis and we can check when we do the causal analysis who caused the problem, who did not take part in what led to the issue, who is responsible. With that document, we can tell who has breached the contract. And above all, continuity. Even when there are personnel or administrative changes, because there is an MOU, continuity is bound to take place. For example, a hospital's MOU with its maintenance partner ensured that even when the chief technician retired, the service agreement continued seamlessly. No interruption, no confusion. No interruption, no confusion. So in essence, an MOU transforms a verbal agreement into a structured relationship built on trust, accountability, and clarity. Again, in essence, an MOU transforms a verbal agreement into a structured relationship built on trust, accountability, and clarity. We'll move to the next slide, routine maintenance. So we want to see all about routine maintenance. Now let's talk about the day-to-day practice that keeps equipment alive and functioning. That's what we mean by routine maintenance. Every day, those things we do that keeps equipment working, functional. Routine maintenance involves regular scheduling or regular scheduled activities that prevent sudden breakdown and ensures that machines perform optimally throughout their lifespan. So there is a checklist. Have you done this? You tick, you do it. Have you done this? You tick, you do it. Just to ensure that the machine is adequately kept, adequately protected and preserved. What are the components of routine maintenance? Number one, cleaning and lubrication. Cleaning and lubrication. Here you dust, you have dust, humidity, and you also have friction. These three are very silent killers of equipment. So regular cleaning and oiling prevents rust, will prevent settling of dust, will prevent tear and wear, and also will prevent frictions between two parts when they are moving in opposite direction or same direction. Number two, you have the calibration. Calibration. This calibration ensures that machines produce accurate and reliable results. Accurate and reliable results. For example, laboratory spectrophotometers and blood analyzers must be routinely calibrated to maintain result accuracy. Number three, you have the routine inspections. Regular checks detect small issues before they become major faults. This is like preventive medicine. Early detection will prevent costly breakdown. Early detection will prevent costly breakdowns. So let's look at benefits of routine maintenance. What are the benefits? Why do we carry out routine maintenance? Number one, it reduces emergency repair costs. Emergency repair costs, it reduces it. Small scheduled actions prevent big, expensive failures. When you have a scheduled action prevention plan, no matter how small it is, it will prevent big, expensive failures. Number two, part of the benefit is that it extends equipment lifespan. And here you have proper maintenance ensures that a 5-year device can serve 10 years or more, depending on how you maintain it. Number three, it improves safety and compliance. It improves safety and compliance. When we say it improves safety and compliance, we mean calibrated and inspected machines comply with safety and regulatory standards. Because when they are calibrated, when they are properly inspected, these machines will work properly in accordance to standards. There will be no disappointment. Number four, as part of the benefits, it enhances service delivery. It enhances service delivery. So functioning equipment ensures uninterrupted care for patients. For example, a hospital consistently calibrated its radiology machines every quarter. As a result, they maintained image accuracy, avoided radiation leaks, and prevented diagnostic errors. That's what routine maintenance achieves. Call it reliability and safety. I like to emphasize here that routine maintenance is not extra work, as many think it to be. It is core work. So if you fail to maintain your equipment regularly, you will pay more in repairs, downtime, and reputation loss later. So you see, you can't afford to see it as an extra work. Routine maintenance is a core work so that you don't suffer needlessly. That takes us to the next slide. Planned preventive maintenance. Now let's take it a step further with planned preventive maintenance now. And that's what we often call the PPM. While routine maintenance focuses on regular short-term activities, PPM is a long-term strategy designed to anticipate and prevent equipment failures before they occur. PPM is a longer version, a longer term strategy. The normal routine maintenance we do are short-term activities. So you have a long-term plan, a long-term strategy to ensure that this machine or this equipment, you prevent failures before they occur. So what are the core components of PPM? Number one, maintenance scheduling. Maintenance scheduling. And this involves creating a detailed maintenance calendar based on manufacturer's guideline. Remember, your detailed maintenance calendar based on manufacturer's guidelines. Not only manufacturer's guideline, you also have local operational data. Local operational data. For example, an autoclave might require inspection every 6 months, while a centrifuge might need quarterly checks. You also have service history documentation. Every piece of equipment should have a maintenance logbook or digital record detailing all inspections, repairs, and calibrations. And this is part of the quality management system for every institution. For example, in the laboratory, every machine there should have a detailed maintenance logbook. The summary one should be on top of the machine with checklists. And that should be filed for every day, and that is the short maintenance. The book put together is the long maintenance plan because it will give you a picture, a trend about the happenings surrounding that machine. So these records help identify patterns of wear and predict when replacements may be needed. The next one, let's see proactive parts replacement. Those are part of the PPM. PPM replaces parts before they fail. It's like changing your car's oil regularly instead of waiting for the engine to knock. And so in healthcare, this approach prevents breakdowns during critical moments, such as operating theaters or emergency laboratory procedures. Let's see the benefits of PPM. What is the benefit of PPM? Number one, it maximizes equipment uptime by reducing breakdown frequency. Number two, it improves cost control because planned servicing is cheaper than emergency fixes. It boosts staff and patient safety. Why? Because equipment failures during use can be fatal, and so prevention saves lives. Number three, it supports accreditation and quality assurance. Why? Because facilities that follow PPM schedules will perform better during audits or accreditation exercises. For example, a tertiary hospital implemented PPM for its oxygen plant system by scheduling monthly checks, replacing filters quarterly, and documenting every action. What was the result? They had a zero downtime for 2 consecutive years. The machine never broke down for once. And it improved patient trust. That's the power of planning ahead. So let's pause a little at this point and think practically. A public health system that has well-structured MoUs performs routine maintenance and follows PPM schedules or schedules is a system that operates with integrity, is a system that operates with efficiency and sustainability. In other words, any public health system that does not have a well-structured MoU, does not perform routine maintenance, and does not follow a PPM schedule, such a system can be said to operate without integrity, without efficiency, and cannot be sustainable. So these practices may sound administrative, but in reality, they are life-saving disciplines. So they prevent system collapse, they preserve resources, and they protect lives. They prevent system collapse, preserve resources, and they protect lives. We have just come to the end of part 5, but before we go, let's summarize. What have we learned today? Number 1, we have learned that MoUs and legal documentation, they define responsibilities, they build trust, and they ensure accountability between partners. Number 2, we have seen that routine maintenance keeps equipment functional through cleaning, calibration, and regular inspection. Number 3, we have seen planned preventive maintenance PPM anticipates problems and prevents failures through scheduled, documented servicing. Together, this builds a sustainable logistics system, and this supports efficient healthcare delivery. The next time we meet, we'll be discussing part 6, and that will be the final lecture on this series of logistics management system in health sector. In the part 6, we will examine equipment disposal and its regulatory standards. We will discuss how to decommission old or damaged equipment safely and ethically, and also in compliance with environmental laws. As I leave you, I like that you remember this all the time. An effective logistics manager doesn't just procure equipment. They sustain it, they protect it, and they retire it responsibly. They sustain it, they protect that equipment, and they retire that equipment responsibly. If you enjoyed this video, why not like it? Give a thumbs up. Why not subscribe if you have not subscribed to my YouTube channel, and also share it with your friends and those you think will need this lecture series. Don't forget, we started from the part 1, part 2, part 3, part 4. And now we're in the part 5, and we'll be discussing the part 6 in the next video. My name is Dr. Henry Isagboin. Thank you.